So what we're going to cover, 15 minutes, have a look at some strategic models for proactively managing health in groups of athletes. These are often talked about in the literature, but very rarely applied robustly within sport. And talk about a couple of examples where that might be applicable within cricket, and then hopefully have a couple of minutes for some questions at the end. Now, this looks pretty busy, but this is something that my colleague Steve McCaig puts together. He's in charge of athlete health planning for Olympic and Paralympic sports. There's 50 sports that we look after at the UK Sports Institute, and a lot of this is from previous research and previous work, but Steve's put this together when he works with sports to do proactive athlete health planning with them and uses this framework. It's got two parts to it. First, looking at the performance threat that's posed by health conditions. Talked about Brendan McClellan throwing away his wicket, might have had a detrimental impact on the team. Health definitely has a performance impact. And secondly, we look at ways we can mitigate those threats in a holistic and a systematic way within Olympic and Paralympic sport, but there are applications in other sports as well. First step is understanding what your problems are. Which are your priority health problems? And there's several ways to do that. Doesn't always just require scientific health surveillance, although that is your gold standard. Secondly is working out who are the priority groups that are affected. Is that select groups or specific individuals? And what are those health threats? What are the risk factors associated again? And again, are they general? So for example, in Olympic and Paralympic sport, respiratory health is systematic, applies to most sports and most athletes. Is it sport specific? Is it shoulder injuries in boxers or lower back injuries in cricketers? Or specific to that individual? And then looking at the fourth step around designing mitigation strategies. A lot of times in sport, we sort of rest at those primary measures, looking at screening and musculoskeletal factors, environmental factors, workload factors. Rarely do we look into, we acknowledge them, but rarely do we plan around secondary and tertiary prevention. And then looking at that systematically is to review those strategies, again going back to looking at your injury surveillance again, knowing what your problems are and trying to measure whether you've had an effect or not. So how do you do that? How do you work out which the biggest problems are? You've got your health surveillance, case reports another example, expert consensus, people like yourselves in this room, coaches and athletes. Even now with fan interaction, you can get the fans' opinion on what they think is causing the injuries and what are the biggest impact on players. AI, we talk about this all the time, and really fancy stuff like machine learning, automated learning, high-level statistics. But actually, just asking your chatbot, asking ChatGPT and asking Bard gives some pretty good answers. And financial cost analysis, something we don't do a lot of within sport. We're lucky enough in Olympic sport in the UK, all of the athletes have private insurance, and we can look at their data as well, which helps us to inform the priority problems. So, expert consensus. I'll bet you that if we sat here for 5 minutes, we could come up with the top 5 injuries in cricket. Everyone knows what they are. Same if I talk to a group of health practitioners working in football. They know that ankle sprains, ACLs in their knees, hamstring strains and groin pain are their top 4 injuries. They will say that 9 out of 10 times you'll get that consensus pretty quickly. You don't necessarily need to do a 5-year prospective injury surveillance study in cricket. We know what the injury problems are by and large in cricket. Although really interested to note that mental health problems seem to be drastically underreported. I mean, I think you had one in your cohort from CPL. I'm sure that there's a much higher rate than that. Asking AI. So I had a look at, well, John was giving his presentation about are cricketers, do they live longer than the general population? I put that into Bard, and guess what it said? They do, so a year more. And it was a very similar statistics that John presented in terms of the ages and things, and so they're very, very good now, these chatbots, looking at AI and asking questions. You've got to check them, they do hallucinate, but actually you can get a lot of information and get a head start really quickly on any type of topic that you're looking at. So I put this into Bard during the week. What injury types have the highest prevalence in elite cricket? And it went through hamstring strains, lumbar stress factors, shoulder injuries, finger injuries, back injuries. All the same ones that mentioned in Akshai's presentation there from the CPL. goes on to say that actually quadricep strains, knee injuries, ankle injuries, groin strains, pretty non-specific concussions. Again, no mention of mental health. I bet if we'd ask this question again in 5 years' time, it'll be a different story. You know, if you want to look at robust health surveillance, Dr. Dhillon produced a really good paper of all of the work that's been done over the years. You'll find the references in there. It'll probably tell you exactly the same things that you would have found in the room or asking your chatbot. Case series analysis. So this is something that Nick and I looked at a few years ago, probably 15 years ago now, when we started seeing a lot of players coming in with head injuries but still wearing a helmet. What was going on there? So we looked a bit like John looked at Wikipedia. We did a crude Google search in those days and found videos of these players within domestic cricket in the UK, but also around the world, getting injuries despite wearing a helmet. Our insurance data we talked about from Olympic and Paralympic sport. This is our mental health claims from 2018 to 2022. Out of our 2,000 athletes, we had 100 who had mental health cases logged in their insurance back in 2018. That's up to over double that 4 or 5 years later. So again, like with anything, with concussion, when you start having concussion awareness campaigns, the rates go up over 5 or 6 years before they even start to plateau. Similar thing with mental health. What you can see doesn't tell the whole story though, because the cost per episode has gone from £1,400 in 2018 down to £1,000. It's down now to £800-900 an episode for mental health. And again, I think that's because we're seeing them earlier, they're going to the right people at the right time, they're getting the right treatment first up, they're having less inpatient stays. And so again, numbers going up doesn't necessarily tell a bad story. It might be that management is getting better. So, risk mitigation. Many of you will have seen this, probably read this paper. Winema Wissa, a very famous sports physician from Canada, put this recursive model where he looked at the predisposed athlete, mainly due to their intrinsic risk factors. Then they become susceptible to injury via exposure to external risk factors. It might be poor protective equipment, it might be the environment that they're playing in, it might be an inappropriate workload. They participate in sports. Most of the time they don't get injured. Most of the time their body will adapt and they'll probably get positive adaptations and go around and go back to the left-hand side. Or they get an injury, which may lead to some negative adaptations, which makes them even more predisposed over on the other side. An expansion on this in 2016 was this Bittencourt web of determinants model, which not only looked at those individual intrinsic and extrinsic risk factors, but the interactions between them. So, for example, the dynamic knee valgus one in there. So if your knee is collapsing in and you have an unanticipated environmental event, you step in a hole, then those two might augment each other. So what are the interactions between risk factors that might also predispose you or heighten your susceptibility to injury and causality? And it looks as humans, athletes, as complex dynamic systems who are working in a complex environment, a sporting environment. So a couple of seconds here. Here's a young fast bowler. And not sure if that will play, probably won't, but just imagine this bowler's running into bowl in an indoor stadium, young male fast bowler. What are the potential risk factors for this young athlete getting a lumbar stress fracture? Okay, I bet you many of you are thinking a lot of these ones. Have they had a previous lower back injury? Nutrition status for bone stress, even a temporary calorie deficit can reduce your bone strength fairly quickly. A young growing athlete is turning over bone very rapidly, is likely susceptible. His physical capacity, his training history, all of those things that we would normally think of straight away as risk factors that would go into that web of determinants down on the bottom right-hand side. But we rarely think about these things. The physical environment, the psychosocial, emotional environment, the team culture, beliefs and behaviours within the sport, family and social support. So if one of the biggest risk factors for bone stress is nutritional status, and you're a young fast bowler who's just moved out of home, living with your mates, not cooking your own meals, and training harder than you've ever had before, bowling faster than you ever had before, those things interact to heighten your susceptibility to injury. So unless you positively influence the things in orange, you're not going to have much of an impact on the causality within these injuries. So complex system is probably the next evolution from the Weber determinants model. So two researchers from the University of Gold Coast in Queensland, Paul Salmon and Scott McLean, have started looking at simple versus complex systems and things that are hard versus easy. And an analogy that I heard about this was, so simple exercise is a push-up. Most people can do a push-up, but it's a hard exercise if you want to do 100. Complex things aren't necessarily hard. Sometimes something can be complex, but can be relatively easy to solve. So it's not just that some complex things are difficult, simple things can also be pretty hard as well. This is an example of something that's pretty simple. Now I look at that and I automatically, probably with my biases, have seen millions of these, not millions, tens, hundreds of these over the last 15 years. I'm immediately scared when I look at that picture. And this is why. That's a result of that batsman with that wide gap that he had in, so we can go back to that. So that's the gap between his grill and his visor is way wider than what the ball is, and then the ball has gone straight through. So McLean and Salmon have used a more complex systems environment, a top-down look at risk factors. So looking at government policy, looking at regulatory bodies, looking at local government planning, company management, technical and operational management, physical processes and actor activities, the equipment and the surroundings, considering all of those things originally within road traffic accidents, but you can also look at those in terms of injury prevention. So we had an old standard for helmets. Helmets were rubbish. People were getting head injuries when they shouldn't have been. There was no international standards. There was no local protective equipment standards in competitions. The helmet market was very competitive. Players wanted to prioritise being able to see the ball, being comfortable, and there was no incentive to improve the design of helmets. But we saw 50, 60, 70 of these where the ball would go straight through the helmet. So then it was a matter of lobbying the ICC medical committee saying this is a problem in cricket, getting the ICC to sponsor it. This is from the top down. Regulatory bodies lobbying British standards to improve the standard, and then getting a committee together to write that new standard technically. Getting the helmet manufacturers to agree to adopting the standard so that they could develop new models which were going to be available, comfortable, protective and affordable. ECB then made that new standard compulsory in 2015. Cricket Australia, I think 2016, followed fairly quickly afterwards. The ECC made it mandatory in international cricket from 2017. And that's only after all of that, so it's fairly simple, get better helmets. Only after all of that was quite hard, 3 or 4 years' work, did players start to adopt it. And injuries got reduced. So this is a new standard helmet. Rather than going through, he got caught, and he's pretty happy that he didn't end up like the first bloke. So again, systematic look at injuries and illness, assess the threat, know what you're dealing with, look at threat mitigation, not just at the level of those primary measures that we're all used to doing reactively, those secondary measures, even looking at regulation. And how can you put that into your off-season? Cricket probably doesn't have one nowadays, but doing your planning, finding out what your problems are, and always doing that plan, do, review, plan, do, review. You can do that within a season, you can do that within a playing fixtures to lift your head up and have a look at how you're managing injuries proactively. So we've had a look at a couple of models and a couple of ways that might be applied within cricket, and we've just about run out of time. Thank you very much.